Yeah, I come from part of that world too. So I'm a licensed clinical social worker. Was holding a certification in drug and alcohol counseling for um, like close to 25 years, but I'm not really certified anymore because I still specialize that if to incorporate that into the treatment that I do with people, but it's not like a primary thing that I do anymore. But was in inpatient settings for drug and alcohol counseling. And yeah, I think MBCT is really suited really well with that. I mean, there is some work, Alan Marlot's relapse prevention program, and there's another substance use disorder focused mindfulness program. I think you could easily blend some of those things in with some of the structure of MBCT as well that might be helpful. So yeah, thanks for sharing that, Samson. Yeah. So if there isn't anything else, I want to go ahead and share my screen. So this is a little tricky how I do this here. So hang on one second. What you're going to see is you're going to see my other monitor briefly so that I can have both open and see all of you while I do this. So let me go ahead and I'm going to share that screen. Just making sure it's picking the right screen here. Yep, looks like it. And then what I'm going to do is open up my PowerPoint again and then make it into a slideshow. There we go. Can you all see that okay? Good. All right. So we're going to be talking about the certificate training and the teaching and a little bit of history of MBCT. Sorry, my mouse is very touchy. Um, So I just want to introduce myself. My name is Bill McCracken. I am a licensed clinical social worker, and I am also a mindfulness-based cognitive therapy teacher and trainer at Brown. I do some mindfulness-based courses locally here in person, and a lot of what I'm doing is through Brown at this time. You'll also see that Patricia Holland's name is up here as well, because her and I share the same slides. Um, and so she is another teacher that's teaching MBCT um, and doing the teacher training as well. So I just want to kind of go into a little bit of history so that we can gauge what we're talking about here within that context. So, if we look at the origins of mindfulness-based cognitive therapy, in the late 1990s, it was developed by Zindel Siegel, Mark Williams, and John Teasdale. And the goal initially with MBCT was to prevent relapse in people with recurrent depression by combining both traditional CBT and the principles with mindfulness trainings and practices. But it wasn't initially set out to do that. The initial interest was um, some research into why people were having recurrent depression episodes that were not responding as well to ongoing cognitive therapy. So, what they found is that traditional CBT, when someone first comes into treatment, is absolutely wonderful, and it still holds the strength that we have seen in CBT treatment for depression. And what was discovered is that in the subsequent relapses that were happening, some of the techniques that were used in CBT, if they were used again, would actually increase levels of rumination. And so there was this big question as to like, well, what could we do differently? And around that time, um, they had encountered the work that Marsha Linehan was doing. And Marsha Linehan, who is the founder of dialectical and behavioral therapy, said, you really ought to look into what John Kabat-Zinn's doing with mindfulness-based stress reduction. And so they did. And then they realized that there was some things within that 8-week curriculum that would fit very well into what they were thinking about to help improve the skill set and the ability to maintain um, you know, mood states outside of depression. And so they blended these things together. So I'm just bringing that up because it wasn't initially created with, oh, let's create a mindfulness-based program that blends in CBT. It was, they were looking at ways to modify or to strengthen some areas of CBT and maybe bring in some other things. And they found that that thing was mindfulness. So if we look at the kind of key mechanisms, the idea here is attentional regulation and decentering, which are parts of CBT. And decentering, if we were to rephrase that as to diffusion, that might sound familiar for people that are familiar with acceptance and commitment therapy. So there's these pieces that are kind of all blended together. Just to keep in mind that mindfulness-based cognitive therapy is a mindfulness-based intervention. Dialectical and behavioral therapy is mindfully informed. So there's mindfulness components, but it's not mindfulness-based. Acceptance and commitment therapy is mindfully informed, and but it's not mindfulness-based. And what separates that is that this is considered to be mindfulness-based because it is following very closely along with the 8-week program and structure that John Kabat-Zinn had in the initial MBSR programs. And that's where a lot of the research is based, is in that structure of 8 weeks, 2 to 2.5 hours per class, a day-long retreat, didactic processing, and all of those things that happen in those courses. So that's why we consider mindfulness-based cognitive therapy a mindfulness-based intervention. So some of the influences that I'm mentioning here are the adapted structures of the core practices and principles from John Kabat-Zinn's MBSR, and then bringing in also cognitive science and research in cognitive science and bringing in elements of cognitive behavioral therapy. So the key insights within MBCT is in preventing and reducing the intensity and the frequency and the duration of the recurrent depression episodes. So what we're doing in MBCT is that we're training awareness of thoughts and feelings to help people to develop a different relationship to their experience, especially difficult experiences. So, Samson, this would be something that I think really plugs in with what you're doing because as a substance abuse counselor, one of the things that I found, especially early on, was that we would kind of go in and we would give people these relapse prevention plans. And oftentimes it would be, no people, places, things, go to 90 meetings in 90 days, obtain a temporary sponsor. It was all those kinds of things, but at least in my experiences, we weren't giving people necessarily solid skills for learning how to deal with the difficulty that then might lead to a relapse. So, one of the things that I find is really interesting about MBCT is that we're teaching people the skills on how to work with their emotions, how to relate to those emotions, their behaviors, and how to put a relapse prevention plan in place so that when these things get encountered again in the future, and we always run into these things as human beings, that we have some idea of what we might be able to do. So the one thing to keep in mind is that MBCT is not like a fix. It is learning how to relate differently to difficulty, to emotion, to behavioral impulses, and then having learned how to relate differently to those things, we're kind of putting some skills into place that then help people navigate those things when they come up in their lives. So in the class, we're helping people recognize habitual patterns of experiential avoidance, of certain kinds of thought triggers that come up that can worsen and prolong depressive episodes. and disengage from automatic negative thinking patterns that trigger depression and relapse. So we approach the automatic thinking differently than CBT. We're not like doing an automatic thought record or what was once called a dysfunctional thought record, which isn't a great label for that. We're looking at generalized thought patterns that come up in mood states like depression and anxiety, because MBCT has also now shown to be effective in working with anxiety. So we're looking at those thought patterns. And what's really beautiful about that particular exercise that we do in the MBCT class is number one, it really normalizes for people that they're not the only ones that have these thoughts. It's universal. And that those thoughts tend to be more prevalent and have more believability when we are in those mood states. And so we're kind of really working on some level of education, psychoeducation around that, and then also relating it to the person's lived experience with those mood states. So the research in MBCT is pretty strong, and the research has expanded into anxiety, not just depression. And it's widely used for mental health and well-being approaches. And it's interesting that in the UK and in Canada, the health systems are recognizing MBCT as treatment as normal for moderate depression. So it is recognized as a valid treatment modality. So these are the founders, Zindel Siegel, Mark Williams, and John Teasdale. Mark and John are in the UK. Zindel is in Canada. Zindel is still teaching for Brown, so we are very fortunate to have him. He comes in and helps facilitate the teacher advancement intensive. So that's really great to have him and to be able to stay connected with him in the development of MBCT and the training of MBCT. Um, so if we look at what MBCT is, and I kind of went over some of this already, but it is a group modality primarily, although there is some growing use in working with individuals, and I am one of those people that are using it with individuals. Um, and it's not really structured yet. I mean, I think myself and Patty and some other people are really interested how we might be able to structure it a little bit differently, but I am using it with clients and I am finding that it is really beneficial. So there are ways to bring some of the elements of the 8-week program into individual sessions working with people. But primarily, it is a structured curriculum. It's an 8-week evidence-based program. Each class is about 2 hours and 15 minutes to about 2.5 hours. I'd have to say, in all honesty, it usually runs about 2.5 hours because there's a lot to cover in every class. It is very highly experiential in nature. There is some didactic pieces there, but really a lot of it is working with people to reflect on their own personal lived experience within the practices that are presented and within what people are discovering and learning through the process. So there is a systematic training um, in foundational mindfulness and meditation practices. And there's some brief practices and informal practices that happen. So informal would be things like, um, just bringing mindful attention to something that you do every day, like folding the laundry or washing the dishes, things like that. But then there are formal practices like sitting meditation, body practices, and walking meditation, the body scan, things like that, that are, those of you that are familiar with MBSR will recognize those things. And um, one of the things that's really different between MBCT and MBSR is that some of the meditations that we do are very short and they're very structured, and that's on purpose to give people an ability to access short, meditation practices that will help them in the midst of difficulty relate to what's going on differently than they might automatically do, which can then unfortunately start the trigger to move down the spiral of depression. So these things are strategically placed within the curriculum to address those things. So in the class, there is inclusion of cognitive activities, as well as going right alongside with awareness practices to highlight the nature of the mind and the key tendencies that human beings have that continue the process of depression and anxiety. And what's interesting is that, and I love this approach because we're not um, saying that, well, because you have depression, this is why you think and act this way. We're saying because you're a human being, this is why you think and act this way. And that under those difficult mood states, they tend to be intensified and exacerbated, right? Those are the things that we're thinking about here. So I think what that does is it helps people realize that this is kind of a universal thing, that all human beings have this. Just because you've struggled with depression and anxiety doesn't mean that it's an isolated thing. It's we're all struggling with mood states that fluctuate. And sometimes those mood states fluctuate to the point of it being something that we might need treatment for, that we might find benefit in a course like this. So that's kind of a little bit of a different approach that we're looking at here. There's home practices as there are in other mindfulness-based interventions. And the idea here is to keep people engaged in the practice during the class. Um, so that's one thing that I think really strengthens the skill sets that we're trying to help people build when they're taking the class. So some of the things that we look at in the A-Week curriculum is automatic pilot versus um, present being awareness. We look at living in our heads. We look at gathering the scattered mind and recognizing aversion, allowing and letting be. Thoughts are not facts. And then as we move towards the end of the curriculum, towards the seventh and eighth class, we look at how we can best take care of ourselves and carrying that practice forward to support ourselves. So in between each session, there is home practice that people are being asked to do. And that's what really strengthens what's being learned and processed in class. So that's why that's important that we have that home practice. And really, that's why we call this a mindfulness-based intervention, because the research that John Kabat-Zinn did on MBSR, the efficacy of MBSR was not just what was happening in class. It was that people were doing things at home in between class as well. So there's a lot of strong evidence to support MBCT. Um, MBCT substantially reduces the risk of depressive relapse, performing comparably to antidepressant medications while surpassing usual care. So, and it doesn't mean that someone would take MBCT in place of medication. Sometimes people would still need to be on medication, but we do recognize that for people that may not need medication or don't want medication, that there is some evidence to show that MBCT is very effective in helping manage those mood states. Um, so, beyond prevention, mindfulness-based cognitive therapy also helps individuals that are experiencing these mood states. Um, it provides them some hope in their darkest moments that there is a way to manage these things. There is a way to relate to these things differently, that we don't always have to just go down the same path that we're typically used to going when we're experiencing these things. And that's the real strength of MBCT, in my opinion, is that we're really working with people to relate to things a little bit differently than they might have done in the past. So, mindfulness-based cognitive therapy overall is really kind of a financially sound alternative to traditional CBT, making the quality of the program more sustainable and widely available to people. So it may be you know, a financial piece up front for the 8 weeks, but there's been research that shows that a lot of people after the 8 weeks do significantly better and don't really need to, um, take it again. They may continue with therapy and bring in what they've learned in MBCT and continue to process that with their therapist. But um, for a lot of people, just the 8 week course is enough to really give them a solid foundation to move forward in their progress and treatment. Some of the research has also shown that when treatments fall short, for those that have not found relief through other approaches, MBCT offers a promising next step. Again, it's not that everybody's going to have that experience, but it is something really interesting to take a look at here. Yeah. I see your hand up, Samson. Let me just finish this part and then I'll address that. Thank you. I see the thumbs up. Great. Um, so, what we're going to talk about next is the certification and the training pathway to do MBCT. Whether that means that you become fully certified or that if you become qualified, and I will make those distinctions as we go through this part. So I'm going to go through all of those pieces in just a moment. But Samson, I want to take your question and then I'll take some other people's questions and then I'll go through the training process here.
Okay, perfect. I didn't want to interrupt because I didn't know if it was that kind of,
No, I missed you too.
Um,
Yeah, no, great. Thank you.
so it was, I mean, this is perfect timing. It was kind of on a couple of slides ago or on the structure. It really interests me the most, the structure. That's kind of what hit a light bulb. If you know IOP, intensive outpatient is usually 10 to 12 weeks, 9 hours per week.
Hmm.
Most IOPs have to split that 9 hours per week into three-hour intervals, right? And
Hmm.
looking at the structure of MBCT, it almost felt like a missing piece of the puzzle. Like it just fit perfectly as
Hmm.
one of those 3-hour intervals in an IOP. But I was curious if you're familiar with any research that has been done on MBCT being used in an IOP setting in that kind of way, where it covers kind of one of those three intervals or anything like that. I know it's a very niche type of question, but
No, I'm not. Nothing's popping into my head right away. I mean, I could reach out to Patty. She might know. And I'm going to put my email address in the chat. And if I forget as we're getting ready to close, people, please remind me because I want you to be able to reach out to me with questions like this. Just because you attended this session and it's over doesn't mean we still don't stay connected. I'd really encourage you to do that. But I do see where you're going with this, and I like this a lot. I think it could fit nicely in that. I mean, especially if you have these 3 hour blocks, right? It's like, okay, well, um, but MBCT is only 2.5 hours. Believe me, there's been many classes, and I know Patty would probably agree with me on this, where we've had to uh, really make sure that we get everything in those 2.5 hours. So if you had three, it might give you a little bit more time to cover everything, especially in the beginning when you're checking in with people in the group. Because it is part of an IOP program, you might extend that check-in period and then go through the curriculum for the 2.5 hours, right? And you might even tweak a little bit of it, not so far outside that it doesn't become MBCT anymore, but tweak some of the activities that are still addressing the exact same themes within that class to be geared towards the population that you're working with. So I think it could fit very nicely with that. I'd love to see that too. Um, yeah, believe me, I was a clinical director at an inpatient unit, and we had an IOP unit as part of that. People would come inpatient, and then they go IOP, and then go out. Um, and the IOP program was just it had a lot of weaknesses, um, and it was we were trying to build, I was trying to build some of this in back then. And I don't think people were really receptive to it. But I think that the climate has changed significantly with people's reception around mindfulness-based interventions. We just know that it really works well. And again, it's not for everybody, but the research does show that it holds up as a sound treatment modality. Yeah. So thank you for that, Samson. Um, so let's look at the teacher training pathway, unless anyone has any more questions before we move. There'll be a short period at the end where I can answer some of your questions and make sure that if you decide to go forward, that you have an ability to stay in contact. All right, I'm taking that as a cue to move on. Thank you.
Yeah, sorry, I dropped it in the chat box, but yes, I'll follow up with an email.
Okay, great. So there's two primary aims of the training program. The program at Brown is a high quality training in evidence-based curriculum, and it does stick to the integrity and rigor of the program as designed and researched with the original founders of MBCT. I am certified in mindfulness-based stress reduction, and I'm qualified to teach the 8-week MBCT program. And because I'm a clinician, I just really, really see the value of MBCT. It's not that I don't still think there's value in MBSR. I just finished an 8-week course with the cancer support community in my um, community, and it was really effective. I really see that MBCT just really has um, really strong um, processes within that 8-week program that really work well for different populations of people. So the program that you come into is really based on that research, and we haven't deviated from the way that it is designed. It's just a strong design. So we're teaching people to be able to work within that design. So the training is really there to deepen and strengthen your personal mindfulness practice and experience while learning some of the core features of the MBCT program. Um, as I mentioned earlier, Zindel Siegel has consulted with us on the development of the training program, and he does co-teach the TAI course, the Teacher Advancement Intensive. So we're still very tightly connected to the lineage of this program. So there's a two-step pathway for teaching mindfulness-based cognitive therapy. You can become qualified or you can become certified. And this is what gets a little confusing for people. So I want to make sure that I do my best to make this clear. When you take the um, training pathway, the first thing that you have to do is you have to take a mindfulness-based cognitive therapy course. And you have to take that for yourself. And some people are like, well, I'm not depressed, so I don't need MBCT. Well, we're all struggling with periods of sadness, periods of anxiety. And I've run into people that come into class like that. And almost every single time during an 8-week course, something came up in their life. It's just obvious, right? In 8 weeks of our lives, something comes up. And then we start relating to things differently through the lens of what we're learning in MBCT. So we really encourage people to, you know, have that experience before they start into the actual training pathway, because then you can reflect on that lived experience. When you go to the next step, you have to take another MBCT course. And oftentimes people are like, why? I just took one. Well, because the next course is called Foundations. And what you're doing is you're taking an MBCT course while you're taking foundations, and they're running parallel to each other. So that, let's say you did your MBCT course on a Tuesday. On Thursday, if you were meeting with your instructor and your class cohort, you would have an opportunity to reflect on that lived experience that you just had. Not only your lived experience, but then start to be able to look at how the curriculum is relating to that experience. So the first MBCT class is your participation in the class. The next one that you take is to become a participant observer. So now you're starting to think about my experience in the class and how does this relate to the curriculum? And it really is a great structure because you really get a chance to see how the curriculum is working for your lived experience, but then also the experience of other people that are in the class. So that's why you do that. And when you sign up for foundations, you're just automatically put into an MBCT class. So it's not like you have to sign up for both and pay for both. It's one foundations course, and part of foundations is for you to be a participant observer in an MBCT course. So once you finish foundations, you get a credit badge, which allows you to be credentialed through Brown to guide introductory mindfulness-based cognitive therapy sessions. It's not qualified to teach the 8-week program yet, but you could go into your organization and you could start presenting what MBCT is, maybe an hour or 2-hour presentation for people. Maybe there's the population that you're working with. You could get a group of those people together and present. And once you've done 3 of those, and that's pretty easy to do within a short period of time, then you can take the teacher advancement intensive. And once you take the teacher advancement intensive, then you are qualified to teach the MBCT program, but you're not certified. Certification is a longer process. So you'll notice that certification is not needed to teach the 8-week program. What certification does is gives you more training. And when you get the certification, you're recognized as a fully certified teacher in that area, and the process to getting there has just deepened your abilities and your competencies as an MBCT teacher. But again, you don't need it to teach it, because actually, in order to get certified, you have to start teaching the 8-week program a few times in order to move into certification. So the prerequisites is a personal practice, and 2 years is preferred. So you have to let us know that you have some kind of mindfulness practice. If you've had 1 year of mindfulness practice, it may be considered, but it would be a case by case basis, and we'd want to talk to you about that. And some people might say, well, why do I need to have a mindfulness practice? Well, because mindfulness based interventions is taught from the experience of the teacher. So if I'm guiding a meditation, I'm meditating and guiding. I know what that territory is like because I've been doing it, right? And when people ask questions, I know what that territory is like from my personal experience, and it allows me to better relate to their personal experience. It's not like you can just learn these skills, um, print out a script of a meditation and lead the class. People know that that's not authentic. So we build a level of authenticity through your own practice. So that's why that's important. Um, a graduate degree in counseling, social work, psychology, somewhere in healthcare or education is also required. Now, again, we've had some case by case basis where things might be a little bit different than that, but when we talk to the person, we realize they have a really strong foundation in working with people in the field, and we've made those accommodations. But primarily, the second point here is what we're talking about here. You have to have some basic training and understanding of CBT. And I don't want people to walk away thinking, oh man, I need to go get certified in CBT before I do MBCT. You could have taken some CEU courses in CBT. I mean, obviously, if you have a graduate degree, you were taught some CBT in your theories of counseling courses and things like that. So that's what qualifies. It's like, yeah, I'm familiar with CBT. I know what this is. You're not speaking a foreign language to me, right? So that's important. And then you have to have some professional experience in working with individuals who experience depression, anxiety, and challenging mood states. Obviously, going into this without any of that experience would not necessarily be helpful. However, we have taken people that are in the process of getting their degree, and we know that as they're getting their degree and as they're continuing training with us, that they will arrive at a place where they have that experience. So we're okay with working with people in those situations as well. Um, and again, as I mentioned earlier, you do have to complete the 8-week MBCT course personally so that you can relate it to your own lived experience. All right. So I just want to show you graphically everything that I just talked about in the teacher pathway. So you have your prerequisites, and then you take foundations. So the prerequisite is the MBCT course, some training in CBT, some personal practice, and then you can take foundations. Once you've taken foundations, after you've guided some, I'm sorry, I'm making a mistake here. Foundations, then you can take, then you become a mindfulness facilitator. Then you teach some workshops, and then you can sign up for the TAI. Once you do the TAI, you can become qualified as a level 1 MBCT teacher. Okay. So now the TAI, the heavier lift is actually foundations because you're taking an MBCT course and you're taking foundations. The TAI is very intensive and very deeply investigating the curriculum and giving you opportunities to practice skills. But that happens over a 5-day period. It's like a Friday, Saturday, Sunday, Monday, and part of Tuesday. So part of Friday. So it's like 5 days. It's intensive dive, but after the 5 days, it's over. So it's not like the foundations course where it was an 8-week commitment of taking two courses together, right? Um, I wanted to leave that. It keeps jumping on me. Hold on. There we go. I'm sorry. If you look at the certification process, you'll see that there's some things added on here. And underneath where we just were, you'll see that you have an opportunity anywhere along this timeline to take the inquiry class for mindfulness-based programs, the ethos course, and then you're required to do some silent retreats, either 2 5 to 7 day silent retreats or 4 3-day silent retreats. And while that's going on, you can start individual mentoring with a mindfulness teacher. And then you would go for teacher certification review, and that's where you would provide a portfolio of the courses that you've taught, the recordings of you guiding meditations, which you would give out to your participants, and a look at your curriculum, how you're designing and laying out your 8 weeks. And the mentor would meet with you as you're teaching a course and go over how you're teaching it, problems you may have encountered, how you manage things. And once all that's done, you can get full certification. So that is the whole trajectory. We've got about 10 minutes for any questions. And again, I'm going to put my email in the chat so that people can reach me if there's questions beyond what we can address today. But yeah, I just want to open it up for folks. Yeah, Anna Maria.
How frequently are the foundation classes ran throughout the year? I know the 8-week class is pretty consistent throughout the year. There's multiple opportunities to take it. How does that compare to the foundation class?
Okay, so I'll just give you an example of how things just rolled out, and I'll give you an example. So the MBCT course is going, um, there's usually two of them being run in, I'll just look at the winter because that's where my mind is right now. So like there'll be two classes in the winter and one foundations, right? And then when we get into spring, it'll happen that way again. Two MBCTs, one foundation. So there's more opportunities for foundations. Every time an MBCT is running, there'll be a foundations running. Unless we have low enrollment and we can't run it, but that hasn't happened at least for the time that I've been at Brown. The TAI, though, the Teacher Advancement Intensive, is run once a year, and it's going to be in April this coming year. So actually, um, yeah, if you haven't completed an MBCT at this point, well, you have, right? Yeah, so like you could take foundations in the winter, and then in the spring, you'd be ready to do the TAI. Yeah, because it's in April and you'd be done. Yeah, you'd be done foundations by then. Yeah.
Yeah. Personally, at least the winter is not the most ideal time. So I was hoping to find out if in the spring it's also offered. But I guess it's kind of self-paced as well. Depending on when you take one, you could wait to take the TAI if it's not happening at the same time. So
Yeah,
it
you
doesn't
could
need to
wait.
be.
Yeah,
Mhm.
it's just that, at this rate, it probably won't happen again until next April.
I see. I see.
But again, that's not a loss because I mean, I did when I got certified in MBSR, I took a long time before I decided to
Hmm.
get certified, and it was great because I taught a lot of MBSR classes, so that by the time I went for certification, it was really not a big deal at all
Hmm.
for me.
That
So
makes
if
sense.
you wait, it's okay because um, you could do introductory courses and really start building things out. Yeah, so it's not like it's a loss or anything. Yeah, and you stay in touch with us, and we'll make sure you get in at the right time. And yeah, yeah. Thank you, Anna Maria.
I have a question
Yes,
about,
Selena.
um,
Yeah.
hi, William.
Hi.
In terms of teaching these introductory courses, do
Hmm.
you help us understand sort of what you would do in those? Say I'm in private practice, so I wouldn't actually have an institution. I imagine I could go to various institutions I partner with or have collaborations with,
Yeah.
or I could run a webinar personally. Is this how it goes? And you would just sort of talk
Yeah.
about the benefits of MBCT and why people might want.
Yeah. Yeah. So one of the things that happens in foundations is you actually have to do a teach back in your class of
Okay.
doing a small presentation. And then you think about your population. And what we encourage people to do is to think about a population that they may actually go out and do one with, so that in the class, you're already starting to build a foundation of what you would actually go out and teach. And then we can have conversations about what might be some organizations that you can do that with. I mean, I'm an LCSW, but I belong to the Delaware Association of Psychologists. It's a professional association, and we all refer people within there. So, um, you know, you, that's an organization where I could just say, hey, I'm teaching a 2-hour workshop on MBCT. People can come to that, right?
And
So,
you're maybe going over some skills, you're maybe
yeah,
leading a few mindfulness practices, talking about how it applies to
exactly.
I do palliative care, so it would be, grief and mortality related distress and
Yeah.
that's the gist.
Yeah, you talk a little bit about what MBCT is and how it's
Okay.
shown efficacy, why it might be beneficial for them, and then you would do a little practice. And then after the practice, you might ask them about their experience and tie that back into what you were delivering in your presentation. Yeah. And we do get people ready to be able to do that before they have to do it.
Yeah. No, it sounds fun.
Yeah.
And after that,
Yeah.
typically, if I'm going to be certified through Brown, I have to wait until April to do an intensive. It's going to be, you're only currently running the TAI in April.
Right. And that would allow you to be qualified, not certified.
Right, right.
But the qualification allows you to teach the 8-week program. And a lot of people stop there. It's like,
Yeah.
I don't need to be certified. I'm doing really well in teaching it. It's working well with the population I'm with right now. So I don't need any more. But other people do want to go on and get more. Because really, the inquiry class is, and you could even take the inquiry class and not get certified. I mean, people do that too, because the inquiry class is such a great class and it really helps you with your inquiry skills. Inquiry is a part of what we do that I think people are never fully done learning. We're constantly learning how to be better at
Mm,
fielding questions and processing things with people in the class.
yeah, absolutely. For people who've taken an MBCT class personally before, a while ago, is there any sense, like, is there a timeline? Is there a time limit of how recently it has to have been?
When did you take an MBCT class?
Like really long ago. Maybe 2012?
Yeah. I think if you took an MBCT course and you have a really good idea, you're going to be taking it again for the foundations. I think we'd be fine with that.
Okay.
Yeah.
Okay. Thanks.
Yeah. No, good questions. Thank you. Um, I'm just grabbing my email. I just want to do a copy and paste it the way I don't make a mistake. So let me just hang on one second. I just want to grab an email to me, and that way I know it's the right one. All right. Okay. In the
Another
chat
question.
is my email address if anyone wants to reach out to me. Yeah, Selena. Sure.
In terms of people in private practice, how have you found, say, graduates having the ability, like, what's the appetite for signing up for MBCT in terms of investments in your practice? And then, you know, am I making sense here? Like when you become qualified and then you put it out there, are you finding people fill up their classes easily? Do you have any sense of like the general population appetite for signing up and going through these courses?
I think the general appetite is pretty good, but you do have to advertise what you're doing.
Mm,
Um, and not everybody knows. That's why those little info sessions and the
mm,
ability for you to do that is really good because, it may be that after you did an info session, now people are interested in
right.
doing that. Um, yeah, I think, like for example, the cancer support community that I just did an MBSR group with. Turns out that there is some interest in MBCT. So when I do my next class with them, it's going in the spring, the early spring, it's going to be MBCT. Um, so yeah, I think as long as you advertise it and let people know what it is, I see it filling up. Um, yeah, and I think this is part of the reason why finding out ways to do it in individual counseling sessions and then building it out of that too could really
Mm,
be helpful. Um,
great.
yeah. So, but that's, we're still trying to build things here in the US because it's not as strong as it is in Canada and the UK, where, as I mentioned earlier, it's recognized as, practice as usual. It's recognized as a valid treatment modality.
Yeah,
Um,
I'm in Toronto,
yeah.
so it's a little more. We talk. I mean, yeah, as much as we say it's available, it's like still difficult to get into a course that's publicly funded here. Yeah.
Yeah. I think there's great opportunities for you to do that. Yeah. The Center for Mindfulness Studies in Canada, they're not training teachers anymore. They were, but now they're just delivering it to the population, which is great, but they're not doing the training.
Yeah.
Yeah.
Yeah, you've been recommended by a colleague of mine does. I don't know if she's certified or qualified, but she's recommended training our
Yeah.
program.
Yeah. See, the more of us that get together and do this, it is going to become very viable and understandable. And people are going to want to take the class. And it is becoming more and more. You could say, well, it's been around since 1990. Um, yeah, and it is recognized. It's just not as recognized as something like MBSR or
Right.
ACT or DBT, and it should be. It's actually a little bit of a deeper dive for people than something like, ACT.
MBSR. Or which
Yeah.
one?
Hmm?
You said it's a deeper dive than.
Then ACT, acceptance and
Oh
commitment
yeah, yeah.
therapy.
Okay. Yeah, I did some
Yeah, I
intros.
think so anyway, because
Yeah.
I've done both. Yeah.
Okay.
Yeah.
Great. Yeah, and I don't know, a few of my friends who do MBSR are now they're having some limitations in terms of how supportive it can be for certain populations and wanting to move more to MBCT.
Yeah. Yeah. Just real quick before we sign off, Andrew, I really appreciate everything that you've put in here, and maybe you can email me. As far as the time for the facilitator course in the spring, I'm teaching the winter until March, so it would probably be the end of March because we usually have like a 2 week window after we've done one, and then we're right into the next one. So it would be probably right around the end of March. The next one would start. Oh, great. You're in my going to be in my MBCT. All right. Well, I don't want to keep people on for too long. I know people need to go, and I really want to thank all of you so much for your presence and for your questions and your enthusiasm about MBCT, and hopefully I'll see some of you around.
Thank you.
Thank you. Take care, everyone.
Take care.
Thank you.